We're live. It's the Dr. Kris podcast. What are you doing, Dr. Kris?
Oh, just getting through a week. Nothing really different.
Getting through a week. He's got an ache. He's got a pain he's going to tell us about. Leads to our topic. I'm going to roll in our intro here. You ready, Dr. Kris?
I am.
If you're like most folks Dr. Kris Foosterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the DrKris.Life podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris podcast. Kris, did you ever think you'd be talking to a bunch of people helping be better lovers?
It's funny. I don't know if I've ever said this to you, but I did a sexual optimization lecture a few years ago, and somehow overnight became known as a sexual doctor. It's kind of funny. I mean, it's something we've always done in our practice, but it's just funny how you give one lecture and off it goes. And one of my mentors is always trying to get me to, he thinks it would be a good book, talking about that. But, it's the one thing that's very important to all of us. And sometimes is a topic no one wants to talk about, right?
Yeah, it's probably kind of hard to demonstrate your authority on that topic as well.
Yeah, definitely so. Probably that's not what the customers want.
So today's topic is living with aches and pains and how to reduce pain and live an active life. The common theme here with the folks that like this podcast, follow it, the folks that you work with are folks that want to take responsibility for their health. They want to take responsibility and work with a physician, not just show up and expect the physician to do all the work. Just give me a med and send me on my way so I can keep doing things like I always do. And that's not you. That's not who we work with, Dr. Kris, right?
Yeah, right. And this topic hits a little close to home. As I was telling you before we jumped on, I hurt myself somehow last week. I've had cervical disc issues before, and somehow I've flared that up again. And, as we always talk about, as I always say, I have the same things that we treat with our patients. They're aches and pains affect most of us. It is part of aging, but it is something that we can handle and deal with and reduce and repair. So I guess I'll be having to walk the walk over the next few weeks on my own journey.
I got this reoccurring tenseness in this back of this right shoulder. I guess it's my mouse hand or something, but I got to go get this massage from this lady. And she's like, I look forward to after it's over, not look forward to the massage, right? She does cupping. It looks like I wrestled with this big giant octopus in the deep sea, and all the suctions. And
Yes.
It looks awful, but it sure relieves a lot of pain. And I can't believe it. So much pain can happen from just a tense muscle. And what's weird is, like you said, I don't know what triggered it.
Well, that's so many of the times we're just set up for these things with life, wear and tear through the years. And I had a similar experience Friday. I went and got a massage, and man, no matter how much I told the guy lighter, he just felt like he went deeper. And, it was one of those, I was like, God, how long is this massage going to be over with? It's the first time I ever really thought about just getting up and leaving a massage. But I think he actually did help me a little bit. It's just, I think what the truth is it's so sensitive, it didn't matter the amount of pressure. But yeah, like I always go back to when I actually herniated a disc so bad that I had to have cervical fusion. the event that made the last bit of that herniation occur that caused all the problems was a pretty mild event. It was actually fishing and just the jerking of the rod. But that was just kind of like a rubber band, that had been cut till the very last band was ready to pop. It's usually many times with these type of injuries that we experience, it's not like this huge event that occurred. It's this one little thing that finally was the topping on the cake of the wear and tear that we've done to our bodies.
Now, you're not a arthritis doctor per se. Your audience is more folks that are active. They're doing things to stay in shape. But as we age, things that we used to do when we were younger aren't isn't applicable now. I mean, I remember when I used to work out, in high school, I approached working out that way for years and years until I realized, wait a minute, Steve, your body's not the same as it used to be.
Yeah, so very true. I would also say as we age, it's really important that with our exercise that we do the right exercises to keep ourselves in as good a shape as possible. But one big point that I'd like to make before we really dive deeper into arthritis, and I like to call arthritis inflammation, joint inflammation, joint degeneration, is preventing. If we can work with a lot of our younger patients, especially when they have major injuries. One of the doctors that I so look up to is Dr. Betsy Earth, the owner and founder of Boulder Longevity Institute in Boulder, Colorado. She does an amazing lecture. She's a retired orthopedic surgeon now doing functional medicine. And she talks about how, like that 20-year-old who has an ACL tear. And all they do with them is they take them into surgery, repair the ACL, do some physical therapy, and off you go. Where the inflammation with that ACL repair, tear and repair was really never dealt with. And believe it or not, those events are absolutely setting those patients up for severe degenerative disease, arthritis down the road. Whereas if we would take the time with those patients and maybe use some peptides and things of that nature, we could potentially, probably, definitely preventing or at least lowering significantly their chances of degenerative disease down the road. So I think it's just if I'm talking to a provider out there, to maybe really be thinking about those younger patients that don't have significant degenerative disease yet, not forgetting about those patients, making sure that we're properly treating them pre-surgical and post-surgical. Maybe we can keep them from surgery if we do some of these things, but B, there's certainly definitively appropriate surgical patients, treating those patients appropriately to try and prevent problems down the road.
Well, when you say inflammation, what goes to my mind is like swelling, but it's probably much more. When you say inflammation, talk to me about that.
Yeah, so inflammation. We know that a very common term today is inflammaging. It's inflammation that causes. I know I couldn't even say that today. It's been a long week already, and so inflammaging is this fancy term now that we have for inflammation and how it causes aging or disease. And so we know that inflammation. Certainly if I like a couple years ago when I, tore my meniscus, and the next day I woke up and my knee was 2 times the size of normal. That's swelling. That's inflammation. You don't need a doctor to say, wow, that's inflamed. Or like you get gout in your thumb or your big toe and it's red and it's hot and it's big. You don't need me to tell you that's inflammation. But inflammation can be much on a more microscopic level, with cytokines and these inflammatory markers that get released into the joint. Things that don't even necessarily feel inflamed, certainly things that don't look swollen, can absolutely have inflammation present. And so inflammation, again, is the root cause of all disease. And we certainly could go back to, well, okay, how does that affect cellular medicine? Well, we know about, again, senescent cells and them getting more present and that causing inflammation. So inflammation is just something that we should always be working on with our patients to lower that, looking at lab markers potentially. Our diets are a huge inflammatory problem for most Americans. As we always talk about, the more we can stay away from bags and boxes with our food and eating, certainly fresher foods, healthier foods, preparing them correctly is one of the great ways of lowering inflammation in our body. But then also, I was actually looking at one of my buddies, Dr. Juan Batista out in Fresno. He did a really good post. I think it was yesterday, about as we get older, so many patients, so many people, so many Americans believe they should be doing more cardio. Like, it's just like, as I get older, I got to do more cardio. When actually I disagree with that statement. We actually, if you want to do that, that's fine. Okay. I'm not poo-pooing the thought of doing cardio, but we forget that resistance training is actually what we need for our joints, our ligaments, our tendons, our heart. You're much more likely to not have a heart attack or stroke as you age if you resistance train at least an hour a week. That was a study that he posted.
Wow.
So, that resistance training that we do, and I always joke, women lift, okay? Women should be resistance training, especially my 40 and older groups should be resistance training so that they look good, which makes them happy, so that they feel good, which makes them happy, so that inflammation is low, so that we're lowering their chances of cardiovascular disease, and then also at the same time, lowering this joint inflammation, helping with lowering the incidence of arthritis.
So let's talk about what exactly is arthritis.
So pretty simple. There's multiple different types of arthritis, but for this sake, I think we just really limit it to two and then really one. There's rheumatoid arthritis. There's osteoarthritis. Osteoarthritis is really what the point of the topic is today, although we certainly could help someone with rheumatoid arthritis as well. Rheumatoid arthritis, of course, is a autoimmune disorder where your body's attacking your own joints. Okay. And there's a multitude of medications that can treat that, but not really the point of the discussion for today, because the most common arthritis is osteoarthritis. Osteoarthritis is basically degeneration of a joint, inflammation of a joint. You'll see cartilage deterioration and thinning associated with osteoarthritis. It's kind of been treated as something that's just going to happen. I have to deal with it. A funny saying I used to always say when I was started is Uncle Arthur came to visit. People would come to, oh, my elbow hurts or whatever. And you kind of look at it and you're like, yeah, it's osteoarthritis. Uncle Arthur is here. And then basically, how do we traditionally treat it? I'm sure it was going to be a question at some point. How we traditionally treat it is NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs. So your over-the-counters like Aleve, ibuprofen. There's certainly prescription ones that we can write like Celebrex and Mobic or meloxicam type medications. And those can be helpful for the short run. The problem with NSAIDs, I always tell the story that one of my absolute mentors growing up as a doctor, I guess, was a doctor. He's retired now, named Dr. Gratch. And I always loved Dr. Gratch because the patients called him Dr. Grouch. Because he just had this bedside manner that you loved him, but he wasn't the most, he didn't make you feel the best, but he was a great doctor. And he had this beautiful Porsche he drove up in one day, and I'll never forget the license plate. The license plate was NSAIDs. And he said that NSAIDs are what paid for his Porsche because, of course, he's a nephrologist. And one of the main things that we can do with NSAIDs is we can really hurt our kidneys. Mm-hmm. Renal function can really be negatively affected by NSAIDs. In addition to GI bleeding and those sorts of things. So they really do need to be used sparingly, NSAIDs too. But because they're over the counter, many times patients think they're safe. So they take them routinely. Sometimes doctors prescribe them routinely, and it can get patients into trouble.
Wow. There's a lot of the sports figures, or at least I think of painkillers and sports killers. I mean, sports guys. But I think of them getting addicted to those painkillers, right? Because
Uh,
they're trying to at least alleviate a certain injury, but it leads to all these downstream problems.
Yeah, and certainly there's a lot of patients that have actually been treated with opioids for significant, because patients can have truly significant osteoarthritis or degenerative disc disease to the point that they may even require opioid medications. And that's where you hear, like the different stories of athletes, taking a few hydrocodones to get through the game or being shot up with steroids. We haven't talked about that. That's another common way that we treat osteoarthritis or degenerative disc disease, is by shooting steroids into a joint. Well, what is that doing? Again, a very and by the way, I've had it before. There's been times that my neck, that it hurts so bad that I'm like, I will take the immediate gains, knowing that there's some long-term losses here. But again, when I throw steroids into a joint, I am going to decrease inflammation, but I am going to also degenerate that joint more. So again, I'm not opposed to steroids as long as they're being used very cautiously. I just think that so many Americans, so many doctors, we use steroids fairly flippantly, uh, and we're not really explaining to the patient that, sure, I'm going to give you some benefit, but I'm really making this problem worse at the end of the day.
So, what causes arthritis? I would imagine an injury, repetitive use of maybe something in your occupation. What are other reasons?
Yeah, so injuries are a major cause. We simply have an injury, and like the person with the ACL repair, we're seeing teenagers now with, by the time they go off to college, have had 2 or 3 ACL repairs, and the amount of inflammation that is associated with that. Certainly, occupational hazards can do that. If you're a major league pitcher and you throw all the time, you're probably more likely to have arthritis in your throwing shoulder than you are the non-throwing shoulder. Discrepancies like, just things we're born with, like leg length discrepancies, things like that, chronic conditions that we're just not treating properly or healing properly can cause it. But many times it's just that inflammation of life. It's poor diet. It's lack of exercise that really, set us up for this, just like we talk about really with all our diseases. So, not being active is just such a crucial part of this. If we can just get these patients moving, Dr. Seeds always talks about, like, before he'll actually treat you for arthritis, or as he's treating you, at least, the biggest thing he wants you doing is walking. He wants you to get moving, if you're inactive, of course. That's just a crucial part of this. You can't just inject somebody's knee and expect that to unwind all of the damage that has occurred.
I think I, I'm amazed I see kids, they're real active and how they fall down and get up and keep running. Now, I don't remember the last time I fell down, but the last time I did, it hurt,
Yeah.
and I used to do it on an hourly basis. And and I just think about, all our conversations, and everything goes back to the mitochondria, that energy thing in your cell. And I would imagine you're talking about being more active. Well, if I just feel worn out, it's kind of hard for me to get excited about being active.
Well, it's a complex discussion, right? Not everything's as easy as it looks on the surface. And everything flows in a circular pattern as well. We can go back to, gosh, how do you treat arthritis? Hormone replacement. One of the things that I see with my hormone patients, one of my slides in my slide deck for testosterone replacement therapy, TRT, is the decrease in inflammation in joints and the decreased pain, decreased joint pain. It's something I hear all the time. I frequently ask my patients, hey, why do you continue on hormone replacement? Oh man, it makes everything hurts less. hey, I used to not exercise that much. I would say in my 30s, I kind of got away from exercise. I felt like I didn't need it because in my 20s, I didn't need it. So my 30s, I did need it, but it took me kind of to my late 30s to mid 30s to late 30s to realize I needed it because I got fat. Wow, as I started working out, things quit hurting as much. Heck, I don't know if I've ever told this story on the podcast. I was scheduled for lumbar laminectomy, actual surgery on my lower back, and I said, "What am I doing here? I'm overweight. Of course, my back hurts. I'm not working out." And I told the back surgeon, give me 3 to 6 months. Let me see. And that's kind of what really started my impetus because I didn't want my back to hurt anymore. I mean, I'd have days where I couldn't get out of bed from back pain. And then it was amazing. Lose 35, 40 pounds, strengthen your core, straighten that spine. Wow, my back rarely hurts. And I can honestly say my back, my lumbar spine rarely ever bothers me over the last 10 to 15 years. Cervical spine, that's been a little bit of a different scenario, but it's a very easy thing. Let's get active. That's why, but it's hard to do sometimes, but that's why we really try to do a deep dive with our customers, our patients, to truly figure out what's going on with them, what's their likes and dislikes. If I told you to go out and go run 5 miles a day and you hate running, if Steve Brown hates running, he's
Amen.
never going to run. Me too, by the way. I hate running. Like, if you were to tell me that was the cure for cancer, I'd probably be screwed because I hate running. Okay. It's like saying to a Texan, never eat another tortilla, right? Like, that's ridiculous. We have to work with our patients to figure out where their likes and dislikes, where their good traits and their bad traits are, and just trying to minimize those negative things. Try to get them moving in the right direction. That's why I always tell patients, I'm not the perfect exerciser. I'm not the perfect eater, but I do a pretty good job for about to be a 51-year-old guy. Except for my neck the last few days, I normally don't say I feel like a 50-year-old guy. I truly feel much younger than my biologic age or my chronologic age, says I am.
So if we were to discuss, what we can do to manage what we might think is arthritis, okay, with less pain, here's what I'm expecting to hear from you. You're going to suggest intermittent fasting.
Mm-hmm.
You're gonna suggest maybe some ketone esters,
Mm-hmm.
right? And
Sure.
there's a common theme in
Yes.
everything that you're going to suggest. So let's talk about that and why it's applicable to so many things that we wrestle with in our health journey.
It's just called wellness, right? And so the great thing about wellness is that I call it a 10 gauge shotgun. It hits a lot. We can put birdshot in it and hit a lot. All right. And so, but life does start with living a healthy lifestyle. And I will continue to beat this drum until the drum falls apart. And that is that the one thing that all of our patients can do, as long as it's safe for them to fast, I'll throw that caveat out there. There's a few, it's rare, but there's a few things maybe you can't truly fast. So discuss it with your doctor. But fasting saves you money because you're not eating. So you can't use cost as a factor in this one. But it does so many positive things. It causes us to burn fat. Everybody kind of, well, not everybody. I was just finishing my lecture, as I told you, for London, and basically 2/3 of the world is overweight. Okay, and so so when I say everybody could use some fat burning, at least 2/3 of the world can use some fat burning. Okay, so we get that. We feel better. We do better. We decrease that inflammation. We decrease it because of the process inflammation, but also we're going a long, extended period, 16 hours at least, without cramming things into our pie hole that causes inflammation. So, that's a positive, right? And so, yeah, it's important. Ketone esters, just again, fueling the body correctly. Steve, if you went out and bought, I don't know, a McLaren, this awesome car, and you go and put crap gas in it, it's not going to run very well. But if you put, good fuel in it, it's going to have a chance to run better. Same way with our bodies, ketone esters, basically racing fuel for the brain and the body. Those
Wow.
those ketone bodies are amazing for us. So yes, it will help, absolutely. And then we can even take that over if we want into peptides and what we can do with peptides to possibly help with arthritis.
So the peptides that, I'm curious to what peptides you would talk about, but I suspect you're going to say the basic ones.
Yeah, maybe. Definitely BPC. Okay. I mean, BPC, body protective complex made in the gastric juices of our stomach. Again, really kind of three major blocks of what BPC does: gut health, brain health, or works on slowing down neurodegeneration, and then musculoskeletal health. And so, yeah, absolutely. I especially like this is where I really like oral BPC. If it's truly like a global arthritis issue, like, man, I heard everywhere.
Hmm.
I think oral BPC. First of all, BPC has no known side effects. It's extremely safe. Really can't overdose on it, so it's just a great product to help with those arthritic conditions. I can just go case after case after case of people that simply just putting them on some oral BPC, which is fairly cost effective, can really alter their course of arthritic pains. So, yeah, I'm sure that one was probably one you might have guessed. There's one called AOD. AOD was originally a peptide that was mainly used and still can be used for weight loss. We can actually have it combined with hyaluronic acid. Hyaluronic acid is an important part of our cartilage growth. You can actually inject those into degenerative joints, and they will help actually regrow cartilage. I think we have told this story a couple of years ago or a year ago on the podcast. When I did tear my meniscus and I was on crutches with a knee twice the size of normal, and Dr. Seeds injected me with AOD with hyaluronic acid the day before I gave my lecture, and I was on crutches. Woke up the next day with no swelling, no pain, and gave the lecture with no crutches. Ended up doing a shot a week for 4 shots, and was back in the gym 2 weeks later, squatting. I have no issues with my knee. This was a knee injury, by the way, that my orthopedist said I was not going to be able to avoid surgery. And here I am, no issues. And speaking of surgeries, one of the most common surgeries that was done for a long time was meniscal tears. They would go in and trim up the meniscus. What does that mean? Remove it. Okay. Go in and cut the meniscus out. Well, guess what happens when we do that? We're throwing bone on bone. So we've seen a big increase in joint replacements. And now, luckily, most orthopedists are much more cautious with meniscal tears. But then, so AOD with HA injections, especially if you have a arthritic joint, that can be a really, really effective way to go about it. But probably my favorite is actually penisin polysulfate. We call it PPS for short. PPS is actually not a joint injection. It actually can either be an intramuscular or subcutaneous injection. And it does a really good job. It increases actual blood flow to the cartilage. It decreases, all the arthritis and the cytokine production in the joint. But it's actually what we call a disease-modifying drug. And so penicillin is the one medication that I have seen that has created such dramatic changes with these osteoarthritic patients. Now, it's not a fast win. It's something that we have to take a little time with. Typically, it can take 2 or 3 months to really see the effects of it, but it's overall a very safe product. And like I said, it can be very effective in not only improving the pain associated with osteoarthritis, but actually somewhat reversing the arthritis because we're causing the cartilage to actually regrow.
Wow, that's for someone that Most of the people that I talk to, and I didn't know about this until I started hanging out with you, is I didn't know all these other options were available because we just go to our general practitioner and they have to follow a very small protocol that's approved by the insurance company. So someone that would want to take advantage of some of these things that you're able to offer, they need to be of a different mindset. They need to understand that they have ownership in their health journey, that this is not covered by insurance, that this is something that is going to take a lifestyle change. Am I wrong?
No, you're not wrong at all. It's just that, yes, you're right. In the traditional model with arthritis, it's Tylenol or NSAIDs, it's steroids, and if steroids don't work, it's possibly surgery, joint replacements, things like that, or learn to live with it. Is something that's told to patients very often. And again, I'm going to confess that I was that doctor at one point in my career, so I'm not trying to throw shade on other providers. Many of them just simply don't know about these alternatives. That's just the truth about it. Like when I have patients say, well, why didn't Dr. So-and-so tell me about this? And I go, because Dr. So-and-so probably knows nothing about this. When you're in the traditional medicine model, you get so caught up in just surviving the traditional medicine model that you don't always have time to really research these things. And again, I've said on this podcast, I found myself for about 7 or 8 years getting all of my knowledge from drug reps. They would come in and sell me on the latest, greatest, whatever, and give me a couple studies, and I would look them over at lunchtime as I was trying to eat in between doing charts. And that's where my knowledge came from. It was all driven by Big Pharma. I mean, literally, that's who fed me the information. And trying to look at a JAMA every now and then, the journal, one of the major journals, or New England Journal of Medicine. But just a lot of doctors, providers don't have the time that they need in order to really stay current. So like one thing we try to do in my practice, in our practice, is I actually try to take every week at least 2 or 3 academic hours. And that's really important to my staff, myself, that I keep that time, because that's the time where I brush up on what's current in the world, staying current. I don't do as much as I would like. There's doctors that I look up to that do a way better job. But the good news is, I always tell everybody, is I have amazing doctors like Dr. Seeds and Dr. Yerth, who I train with, who help also keep us SSRP docs current as well. So it's just, extra time you have to put in.
And that means that the patients that would really excel or flourish under work would need to have the same attitude. And, one of the things that we talked about before we started is that I think it's important to me that we make sure that the audience that's listening, that you have ownership. If you're going to reach out to Dr. Kris and work with Dr. Kris on this, he's not going to do all the work.
Yeah, I can't. There's homework associated with these things, and we're not afraid to actually occasionally tell patients we're just not a fit for them. And we don't mean to create enemies. We just like, hey, really, I think your money's not going to be well spent here, because there's stuff you're going to have to do on your own. And if you're not willing to change your habits, eat a little better, then what we can do for you might be limited.
Yeah. So cool. So we need to adjust our diet a little bit. We need to lose some weight. Obviously, we want to get some sleep. And then there may be some peptides that we could consider. And you mentioned hormones. Can you just riff a little bit about that for a minute?
Yeah, again, as I always say, hormones are the foundation of wellness as we age. And if we don't fix the foundation, we're not going to do well. And so any patient that comes in that I believe is hormonally imbalanced, and we try to get all of our patients to do hormone labs so we can look at their hormonal balance. That hormonal imbalance, menopause in women, andropause in guys, is adding to the problem. And it's a big percentage. And if we don't fix that part, we're missing kind of low-hanging fruit, as I would say. Something that we can fix fairly easily, that not only are they going to joints going to hurt a little less, but they're going to feel better. They're going to do better. Going back to sex, they're going to better sex. They're going to think better. They're going to sleep better. That's a pretty easy sell to most patients. If you're like, hey, you can help all of those things, and my joints get a little bit better. So sometimes with arthritis, for us, it can be as simple as just uh, replacing their hormones, because a lot of the patients that come in aren't specifically coming for osteoarthritis. It's one of their complaints. And so, they're fatigued, they're gaining weight, their libido is poor, they're not sleeping well, they're not thinking well. And oh, by the way, my joints hurt. And then we do their labs and see that they're remarkably hormonally imbalanced. So most of the time, what I'll do is replace the hormones, put them on some oral BPC, and reassess. Of course, giving them dietary tips and exercise tips, but then seeing them back, and you'll be amazed how many that come back in 2 or 3 months and like, wow, yeah, my joints don't really bother me anymore. That's really so much better.
Well, let's put on a little music here. And on this conversation, and you're wondering how you can work with Dr. Kris. Dr. Kris, tell us how.
The easiest way is just go to DrKris.Clinic.com, hit the consultation button. That'll go immediately to one of my staff members who will reach out to you, typically within 1 business day, if not sooner, and get you in. Or you can just call the office, 817-599-9902, and talk to one of the lovely ladies that will answer the phone.
Do I have to be within your city or state?
Well, right now we're only treating Texas and Tennessee patients. And so if you are in another state, you would have to come do 1 visit with us here. But we are going to be adding multiple states soon.
All right, Dr. Kris, another good episode. I learned a lot. I always enjoy these. I obviously, hanging out with you, I apply a lot of these things. Whether I do a good job or not, that's to be discerned. But I enjoy talking to you. You're the kind of doctor that'll talk to me. That's kind of rare. It's frustrating. They're just too busy most of the time, and so I enjoy this time. I appreciate it.
Thanks, Steve.
Those that are listening, be sure to reach out to Dr. Kris at theresearchclinic.com, and we're going to roll it out, and we'll see you on the next episode of the Dr. Kris podcast. He's out there. He's on Buzzsprout. He's on YouTube. He's all over. He's going to be in London soon. We'll see you. Bye, Dr. Kris.
Bye.